his breast line. Somebody did a good job with him. His upper trap and his lat are playing a tug-of-war game. And right now the lat's winning. But there's a little degree of that going on in every one of your patients who have a flat what? You could have said flat back, or you could have said flat diaphragm, and you'd have been both right. Do you see his flat back? That back should be right there, rounded when he reaches forward, and he can't do it. He can't do it because he can't what, Chad? Say the word rotate the rest of the weekend. He can't what? He cannot rotate. He has no glutes to do it with. He can't shut off one lat and get the other lat to what? Work. I could put my salad this lunch I had with you, Heidi, I could have put it right there and I've been fine. See it? See it? And then when you ask them to rotate, all they do is they get worse. They do more lat work when we ask them to retract, I mean. Okay, next muscle, serratus anterior. Let's make this quick. Remember the serratus anterior attaches to the outer surface of your border of your ribs 1 through 8. It's kind of a cool muscle, I think. And it goes to the vertebrae border of an inferior angle of your scapula, the medial angle of your scapula. It pulls the scapula onto the rib cage. Here's the big thing. It's not the big thing. Yeah, we know it draws the scapula forward. What you forgot was it draws the ribs what? Back. That's a big thing. That is a very big thing. When that serratus kicks in, guess what drops off? What did we just talk about? Lat. When that serratus kicks in, the lat just drops off. Oh my gosh, I'm not flat anymore. I can't work anymore. When you were walking all fours, you didn't have big lats. When you got up on 2 feet, you got big lats. When you were on all fours, you didn't have big lats. You had big serratuses. Lions and tigers and bears have big what? Serratuses. They can claw you to death. They have control. We lost control when you went upright. And that lat is too what? It's too active, inhibiting this serratus from work. A flat back takes away your serratus. Now I'm lost in space. I have to use my accessory muscle. Is it possible, Linda, that I'm learning how to work my neck for breathing because my shoulder blade doesn't have enough support for rest? Therefore, I pull my shoulder blade up. At the same time, I trigger on a response to breathe. And that's easier to do both with one throw of the snowball. I think I'll just keep doing that. See, Linda, which came first? Are you guys following me? I think I'll just kill 6 quail with one shot. If I just pull it all in at once, and at the same time, lean over the right side and drop my shoulder. So I can continue to use my hand in front of my face for everything I do, including feeding my face. That's what I think's going on. And if you read books, Scientific Mind, you'll understand. It's a system. It's a complex one. And the reinforcement, as long as you got a reward and you did something better with something less, oh, you will do it again and again. If I can do it faster, better, quicker, and it only costs me a couple cents, I guarantee I'll do it again. Speed. That's what it's called. Oh, I think I like that. I want to see Chad. I want more lat, buddy. I want to get as much lat as I can because I can do this so much easier. I've never been better at it. As they hold their breath, as they don't ventilate. I think you guys know. That's a big deal. So that's serratus muscle. We're going to talk more about tomorrow under brachial chain. Lower trap goes from that spine of that T6 and 12 all the way up to the spine of the scapula. Spine to spine. Huge rotator of the scapula and a huge rotator of the spine. Pulls and depresses the scapula, lowers and pulls the scapula. I see nothing but gen scapula here. What happened to the thorax? What happened to the rib cage? Chad, that came right out of a book. There's no mention of what it might do to the spine. James Anderson did a really good job. I don't know where it's at. I think it's coming up. But there's a great discussion about what lower traps do for rotation of the spine. Tomorrow, the brachial chain course is centered around the serratus anterior, the triceps, and the lower trap. Full day on it. So we're going to talk about the long head of the triceps and the lower trap tomorrow. So I'm going to skip this. We'll go over this tomorrow. But we're going to talk about this long head of this tricep, the hamstring of your hip bone. You all got a bicep femoris, right? Hamstring. This is the bicep femoris of the shoulder blade. And there's, I think, the left and right abdominal low trap series I'd like to have you read. And I will not read that for you, but I encourage you to read it. So you understand that the low trap is a rotator. Hey, Chad, this rotation word's coming up a lot, isn't it? It's kind of a major word of the day, isn't it? Rotation, rotation, rotation. What kills rotation? The other two planes. You did a nice job. Sagittal and frontal. You take those two planes, you lock them up, you have no rotation. You take sagittal away, you have no frontal. You can't rotate. You can work on frontal plane, and if you don't have the ability to overcome sagittal movement restriction, you'll never get transverse plane. So, rotation. Page 18, the other structures that provide form to your body is your rib, sternocostal joints, the fascia, the costovertebral joints, the crural we talked about, and the big one is barometric pressure. And it's huge, and we just don't have time to talk about it. But in a course like today, it's got to be included in your literature. Tomorrow morning, we're going to talk about this, Jen. We're going to talk about this mediastinum. It's kind of a hot button of Jen's. It's a hot button of mine. We're going to talk about how to restore this today a little bit. We want this sternum to come down. While I have your attention, would you all look at the screen? Look at this fourth rib in the front is in the same line as your eighth vertebrae in the back. So when you get to T8, you'll know you're there with this manual technique if you just put your hand on the end of that sternum. So wherever your sternum stops, right below that is what? The dome of your diaphragm. So there's the dome of the diaphragm. There it is. And that level is a major level for today. Okay? I just thought I'd show it to you right there. Does that make sense? What happens when you have a flat diaphragm and a flat spine? The sternum goes up, and the fourth rib is now no longer in line with the eighth vertebrae. It's in line with possibly the fourth, fifth vertebrae in the back. It's way up there. It's high. I showed you a lot of those pictures this morning and this afternoon. All right. And these are other things that are also included that make your thorax look like it does. Not excluding by any means this clavicular pectoral area that we're going to spend a lot of time on tomorrow. And we've already covered this to some extent, but I thought I would make sure you understand that this is probably as important as the degrees are. How many degrees of movement do you need out of the spine, the thoracic spine? Please circle it, by the way. It's not lumbar. The thoracic spine, with respect to sagittal, frontal, and transverse activity. All of this activity should result in this much activity with your airflow, inhalation and exhalation, with the average for 31, 35-year-old given in your handout. I like this spirometer. We talked about it this morning. Maybe this afternoon, Jonathan, maybe you could help me demonstrate that when we do the lab part so I can show you what a spirometer will do for a body. I'll either lock you up or unlock you. You'll do it with the spirometer. We'll just have some fun. Okay? So this is a lady who's laying on her back, and she has her right arm above her head. She's been PRI'd because whoever's working with her is saying, look, I don't want your lat, I don't want your intercostals, I don't want anything holding you down on which side, everybody? The right. We'll side bend you to the left a little bit. We'll put this in your left hand, and I want you to take a breath in through your nose, and I want you to blow out as hard as you possibly can with a little bit of posterior tilt. She doesn't know what a posterior tilt is. So you put your feet on something, your feet on a block or on a wall, I don't care. When you say posterior tilt, that's about as that is really, I have no idea what you mean by a posterior tilt. I'm even a physical therapist. I don't know what a posterior tilt is. You're really going to ask somebody to do a posterior tilt? You know, a posterior tilt requires muscles that really don't even go across the hip. They don't even get close to the hip. But if you can exhale correctly, I'll bet you'll do a good posterior tilt. So I work on that. I have my hand where on this lady? I'll ask you to do a posterior tilt. Can you take your T12 and L1 and flatten my hand? That felt good. Oh, you mean like this? Yeah. Oh, thank God you can do a posterior tilt. Instead of me sitting there telling you, Brianna, can you feel your butt? Can you feel your hamstrings? Can you feel the wall? Which I like all that. That's mild kin. Of course, I'd be praising the good Lord on mild kin about hamstrings, butt. You got it. But in this course, what are we really going to talk about, Chad? The diaphragm. Can you get that spine to touch my hand? Just blow out and touch my hand. And then I think we repositioned you. So that's what she's doing right there. You have the cave days, pump handle, bucket handle. Okay, not picking on anybody. Ribs, pump handle and bucket handle. Great stuff. You bucket handle and pump handle on the same side with both your ribs, you're in trouble. You understand the 22nd century? 22nd century is you better be bucket handling on one side as you pump handle on the other. That's 22nd century. Do you understand what I just said? These top ribs have a little different attitude than the bottom ribs. And they should be directly what? Opposite. Directly opposite of what's going on. When those ribs move in direct opposite directions with bucket handle and pump handle, what do we got? Let's see. Rotation. Okay? So page 20 and 26. I like this schematic. I put this together years ago. If we look at a thorax, and I thought I had a rib that I could show you how the rib moves on the thorax. So I grabbed the thorax. With regards to the thorax, you have these true ribs and we have some false ribs. This chondral portion, and there's some false ribs down here that really are just not all the way connected. They're kind of independently hanging. But let's take an average rib, because you have the mama ribs in the middle, and you got these big daddy ribs down here, and you got these little baby ribs up here. Okay? But let's take somewhere in the middle, something that's attaching to the sternum, directly to the sternum. Let's take maybe rib number 6 or 7. And if I took rib number 6 or 7 off the rib cage and I held it in my hand, I'd put the rib in front of me where the back of the rib is in front of my face. And I'm now looking at the posterior part of that rib. Does that make sense? So I've got two ribs that have a spinal column, and I know this is fairly simplistic, but I want to get a perspective analysis down with you this morning. So if you look at the rib angle, you have a rib angle in the back, you have a rib angle in the front. The rib angle in the back is more acute than the rib angle in the front. It's more broad, okay? That rib angle in the back has a neck. It has a little bit of a surface that's flatter. And then it starts to move around. It starts to turn. That is the angle that we refer to in your manual. That's the angle, okay? I don't think that's too confusing yet. Okay, then you have a superior surface of that rib and an inferior surface of the rib. So if you look in your manual on page 22, you're going to see that there's a little mention of the superior surface of the rib, the superior palpable surface of that rib. Now, I'll tell you when it's more palpable here in a minute. It can be either more palpable or less palpable, Stephanie, depending upon which direction the rib is going in. Okay, so far so good. So we've covered there's the front and the back perspective. You have an angle that leads into a neck that attaches to the vertebrae. And then you have ribs that turn. And when they turn, that angle will either move up or down, in the back, because that's what we're looking at right here is the angle. Or if you look at the angle